here. This is the cephalic vein. As I move towards the hand, you're going to follow the cephalic vein, the median cephalic, what we call the median cubital vein or median cephalic vein, down towards the wrist, moving, moving, moving. You can see the brachial artery here. You can see the perforating, very short perforating vein. So this is the distance. Cephalic vein. Here's my needle. Straight down, boom, and try to keep the needle tip in the center of your field, okay? And then I'm going to slowly move my needle down as I move my ultrasound down towards his wrist. We're talking millimeter by millimeter. You're going to follow your needle down. Let me just take a look where I'm going just to make sure I'm going the right way. Again, follow my needle, move the ultrasound, follow the needle in the center of the vessel. Okay, and then I look ahead to see where I'm going, so I know where I'm going. All right, and I'm keeping it in the center. I don't feel anything. I can move my needle around. I know I'm not hitting the wall. Very important. So now I'm getting to the point where I'm going to hit the radial artery right here, right there, and that's what I'm calling. You can call this the 3 o'clock position, or whichever way you're seeing. I think I said 9 o'clock before. So I'm going to turn this longitudinal so you can see where my needle looks like here. So here's my needle, and my artery is right there. Okay. So it's almost like right at the takeoff of that proximal radial artery. So you can look at it both ways, but I like to do it in transverse because I don't want to swipe that artery, swipe the wall of the artery. I want to know exactly where my needle tip is going into the artery. So I'm about to go into the artery. I want to make sure I'm keeping my needle in the right angle, and I'm about to puncture right through. Okay, I'm going to push it, and it goes right in. Keep the needle tip up. I'm actually pushing down on the needle because I want it to go up, not down. And I feel that there is blood flow here, arterial flow. Perfect. I don't even have the tourniquet up right now because this guy has big vessels. This is unusual. So now I'm going to put the wire in. Then you're going to always make sure your wire is in that artery all the way down in the forearm. Okay, it's perfect. So you see where my
really important for people don't put the wire deep enough. Sheath prolapses.
Inner diameter 6 French sheath. No heparin because he's on Eliquis already. But thank you. Okay, now we're going to change coming out of the sheath. You want it to stay in the sheath. So you want your sheath to be buried in the artery past the transition point, past where you're going to create the fistula. Okay, and I'm going to watch it go in under ultrasound. And we're going to watch it. Okay. And what's important is you want to know exactly where your transition zone is. And so this is in transverse. I could see my sheath going right. That's my transition zone. Boom. Right there where my arrow is. Okay. Kind of right there. And how do I know that? Because I see the other artery going down. I knew the ulnar artery was right there. Now I'm going to move my device into the sheath, and you're going to see it. I'm going to help hold this for me right there, the sheath. So I have some leverage. Yep, I'm going to push the sheath in. Push the device into the sheath. And there it is. Now I'm going to push the, let go. I'm going to push the sheath in deeper because I want to go a little bit further. And then my device is in the sheath, okay? It's not out of the sheath. But I want my device to be past the transition zone. It's right there. Perfect. Now I'm going to ask Vinny to pull the sheath back, okay, and expose my device, okay, until it's hubbed. Now it's hubbed. Perfect. And now what I'm going to do is, I know that my transition is right there. Zone is right where the arrow is, okay, right here. So I'm going to pull the whole thing back, the sheath and the device, until I feel a resistance. And I'm going to make sure the device is actually lateral. So it's always lateral, almost always lateral. So it's catching the artery in the right morphology, in the right direction. So that's something you can see when you look at the device. So it should be catching pretty soon. Right around here. Yep, I feel some resistance here. Perfect. Okay, so that's my transition zone. Next, it's a little bit awkward, so I'm going to stand up. I don't know if anyone else ever stands up. I'm going to hold my grip exactly the way I want it to. And what I'm going to do is close the device, release it a little bit forward, tension, and you can see me closing the device. And perfect. Now there's resistance there. That's exactly what I want. Okay. Patient, are you awake? So I always warn the patient right before I'm about to zap him. He's sleeping. So you're going to see little air bubbles, and you're going to hear a high-pitched sound, followed by a low-pitched sound, which is the cooling. So go ahead, Jen. Generate on. I'm going to watch him. Hit it again. Okay, you see the air bubbles right there in the transition zone, right near my arrow. Okay, I'm not putting any pressure on this catheter, very neutral. Now it's cooling, that low sound. And as it goes back to the high pitch, I'm going to pull back ever so gently. Okay, turn it off, because I could feel that there's no resistance, and that's how I know it's done. Okay. Now what I'm going to do, find where my sheath is exactly. So I want my sheath to be in just a little bit, just a touch. Okay, now you're going to back it out for me. Okay, he's going to back it out for me. Good. I'm going to grab the wire. Okay, perfect. Fine. Okay, so I already have a fistula there. So we have almost don't need a balloon, but we're going to do it. Yeah, I'm going to pull the sheath back a little.
There's a great image of the anastomosis.
And again, you can see the balloon. What's amazing is you're doing everything under ultrasound. I don't have my lead on. It's incredible. First time I'm getting to sit down during the whole day. I'm using a monorail 5x2 balloon. You can use a 40 centimeter length balloon if you wanted. I'm going to watch my balloon go in to the area that I want it to go into. So again, that's the transition zone right there. Just hold my sheath right there, Vinny. Pull my sheath back a little bit. And I did it 3 centimeters behind because it's a short perforator. So you're going to adjust your length depending on how big your perforator vein is. This is good. I might put in just a little bit deeper and pull my sheath back just a little bit. That's perfect. Let's go right there, Vinny. All right, we're about to do some ballooning. Let me know if you have any pain. Go ahead. How's the blood pressure? There's the waist. What is it? Okay, 138 is his blood pressure. Now you're going to go to 12. That's Alex's favorite number. If you're going down because it's the right angle, it might be better. That's what I'm thinking.
Maybe do both.
Yep. Take it down. Okay. Great. Now we're going to pin and pull the balloon out, and then we'll take another. A volume study too. Kind of goes like this. Okay. Okay. Push the auto button on this G machine. It's nice because you have that. Okay, and now we're going to freeze. And we're going to measure the diameter of the brachial artery. And we have 810 mLs per minute. I think that's pretty good. What do you think?
Great case. That looked, made it look easy, that's for sure.
It's because it is easy. It is easy. And just, make sure you pick the right patient in the beginning. You want to start off with a teeny tiny vessel, and once you get good at that, you can get into more complex procedures, but anyone can do it. If you can do a PICC line, you can do this.